At the oncology department of the University Hospital Basel, it is common for patients to receive chemotherapy treatment as outpatients. This means they can return home after their treatment. During the appointment, the physician writes a prescription for medication tailored to the individual patient's medical condition. This prescription is immediately dispatched to the hospital's pharmacy. Pharmacists produce between 70 to 90 chemotherapy medications every day. The composition of the drug therapy is carefully checked and approved by both the pharmacist and the oncologist treating the patient. Pharmacy staff produce the medication based on the patient's prescription by dosing the various active substances and diluting them in an individual containment. Everything is checked electronically by PC. Then the individual drug components are transferred to the pharmacy's clean room, which is protected by an airlock. Preventing contamination is a top priority. This means appropriate clothing must always be used when entering the area. This rule is strictly observed for every individual production run and not only protects staff, but most importantly, patients. Computer software continuously monitors, controls, and logs the production process for each individual patient-specific manufacturing. The substances are processed in sealed systems so that a sterile environment is assured at all times, and staff are fully protected. Finally, the dosage of the active substance is checked using a balance connected to the computer, and the infusion bag is filled. After labeling the bag with the patient's name and date of birth, the infusion leaves the clean room through the airlock. For added security, a pharmacist checks the medication one last time and confirms the right quality. The chemotherapy bag is then securely packed, ready for transport. An employee of the hospital pharmacy phones the courier service to inform them that the infusion is ready for collection. Next, the bag is transported immediately through the hospital's underground corridors, straight to the patient. Here, it is important to avoid excessive shaking that could affect the sensitive medication. When it arrives on the relevant ward, the nurse takes the medication and prepares the application of the chemotherapy for the patient. All staff always make every effort to reduce the waiting time for the patients to receive their parenteral medication to an absolute minimum.